So we're going to start with our frontal, come around our orbital, palpate our zygomatic, buccal, and parotid. And while we're there, we're going to go ahead and check for TMJ by having them open, wide, and close. Then we're going to come down, check the submandibular glands by rolling the submental glands and make sure you're rolling out. We'll come back, check the preauricular and postauricular. And then we'll come around to the back of the head, check the occipital nodes, the parietal, and back up to the frontal. Then we're going to go down and instruct the patient to turn to the left, and we're checking the anterior and posterior cervical nodes and the supraclavicular nodes. And you want to make sure you check this on both the right and left sides. Then you'll instruct your patient to look straight ahead, and you will be checking the thyroid gland by having the patient swallow. And after you do your extraoral exam, you want to make sure you deglove, wash your hands, and put on a new set of gloves to lay her back and do her intraoral exam. You're going to begin your intraoral exam by first palpating the upper and lower lips and observing the buccal and labial mucosa. You're going to be palpating the parotid gland and ducts again. You want to make sure you're looking at all the attached gingiva, the mucogingival junction, the alveolar ridges, just to make sure everything looks normal. And now we're going to palpate the floor of the mouth, and we're just checking the submandibular and sublingual salivary glands. Then you can grab your mirror and check the hard palate, soft palate, and the buccal mucosa. You also want to instruct your patient to put their tongue to the roof of their mouth so you can check sublingually, and then you're also going to instruct them to say ah, and this will allow us to check their lymph nodes and their pharynx. And last but not least, you're going to get a wet 2x2 gauze and wrap it around the patient's tongue. You're going to pull the patient's tongue to the left side. You're going to observe and palpate the lateral border of the tongue. And you will do this for both the right side and the left side.